So CAP is an infection that you develop in the lungs. I'll specifically be speaking about bacterial pneumonia that's treated with antibiotics. So the signs and symptoms that your patient is going to come in with CAP is going to be shortness of breath, fever, productive or non-productive cough, fatigue, loss of appetite, and they may have had a viral infection such as a cold or the flu within the last week or so. This are actually fairly common. There are a lot. Your immunocompromised individuals such as people with a splenectomy, or your HIV patients, or your sickle cell patients, or patients on anti-organ rejection drugs, they are going to be at higher risk of developing CAP. Also, your patients with diabetes, hypertension, obesity, your patients who smoke, your patients who abuse alcohol, or your patient who abuses drugs, they're all going to have a decreased immune response, and so they're going to be higher risk of developing CAP. So the pathophysiology of CAP. So we all know the lungs' job is to perform the body's gas exchange. It is a type of pneumonia. Streptococcus pneumoniae is the most frequent cause of CAP. There are actually 90 different strands of bacteria that can cause CAP, but frequently it's the Streptococcus. Pneumonia is an infection of the alveoli in your lungs. The alveoli fill with fluid and cells, and then the infection spreads throughout the lungs, and your lungs become filled with fluid, pus, cells, and then the lungs can no longer do their jobs of exchanging gas and carbon dioxide, and this leads to your patient becoming hypoxic and hypercapnic. So the typical treatment for CAP is antibiotics. The most typical prescribed medication is amoxicillin. This can be given oral or IV depending on the treatment setting where the patient is treated. Amoxicillin stops bacterial growth. It's important that your patients finish their entire round of antibiotics. Not finishing when they feel better leads to antibiotic resistance. So the most common side effects are going to be upset stomach, vomiting, diarrhea, the typical side effects of antibiotics. Of course, your patient should immediately report to their physician if they have any signs of anaphylaxis. The gold standard diagnosis for CAP, you're going to be looking at a chest x-ray, a sputum sample, a CBC, and a CMP. You're also going to be going off of the patient's symptoms. But of course, your sputum test is going to tell you exactly what type of bacteria is causing your pneumonia. So also a medication that has a big part in CAP is a preventative medication, the pneumococcal vaccine. Pneumococcal vaccines has been available since 1983. They're recommended for all at-risk patients, anyone over the age of 65, and infants and small children under the age of 2. Vaccines have been shown to significantly reduce the amount of patients with CAP. Sometimes patients can be very resistant to vaccines, and it's the nurses and physicians' job to educate patients about the importance of vaccines. So expected within a few days of starting your antibiotic regimen, you should start feeling better. And again, it's important to educate your patients on finishing their antibiotics even if they're feeling better. As far as genetics, environment, and lifestyle go, genetics is really not that relevant to the development of CAP, but your environment and your lifestyle is. Your risk factors of smoking, obesity, even hypertension and alcoholism. Your patient can be educated on the importance of losing weight, stopping smoking, stopping alcohol. Your patients who have uncontrollable risk factors, such as your immunosuppressed patients, need to be educated on the signs and symptoms of CAP, and that they need to see their physicians as soon as possible so they can get treatment. CAP can become severe enough for patients to be hospitalized, and about 10% of patients with CAP will die from CAP. So CAP has significant mortality and morbidity, and it does cost the healthcare system a large amount of money every year to treat.